Welcome again. In this lecture, we discuss two terms, immunoassays and the poultry diagnostic. Immunoassays play a vital role in the control and prevention of poultry diseases. They allow for early detection of outbreaks, which helps to prevent the spread of disease and minimize economic losses. They are also used to monitor the effectiveness of the vaccination programs and to ensure the safety of poultry product. We speak about the control and prevention of disease and the early detection of outbreaks to minimize economic losses. Also, effectiveness of the vaccination programs we used, especially in Gomboro, in IB, some diseases we can't control without monitoring the flock. The discussion of diagnostic. This is a process of identifying the cause of illness or disease in poultry. Identifying the cause of illness or disease in poultry. This is crucial for ensuring the health and well-being of birds, preventing the spread of diseases and maintaining the safety of poultry product for human consumption also. Diagnostic process, it's a process and it's full detail in the course of poultry diseases. It's in Udemy. Poultry, but in brief, diagnostic process start with our observation. This involves observing his flock for sign of illness, such as lethargy, decreasing appetite, respiratory problem, diarrhea, unusual behavior. Anything abnormal we can detect with our eyes inside when we are in the flock or visiting a flock as a veterinarian or a health provider for the flock. Sample collection start after we observing the birds. Samples such as blood, tissue, feces collected from the sick birds or the environment for further testing. Laboratory analysis. Various laboratory tests are employed to identify the causative agent of the disease. These tests may involve immunoassays. As mentioned earlier, these tests detect the presence of antibodies or antigen associated with specific pathogen. We associate our observations, our detections as a veterinarian, as a health care provider for the flock. Bacteriology. Immunoassay. We will speak about the immunoassay in full detail, but we give a review of our knowledge about poultry diseases. The immunoassay. These tests detect the presence of antibodies or antigens. The antigen or antibodies, this is the evidence we can catch about the disease. Bacteriology, this is a science, and this is has basics and practical. Involve culturing bacteria from sample to identify the specific bacterial species causing the disease, and this is techniques we speak about in our courses about bacteriology and practical bacteriology. Also, virology is a science, and it has a basic and practical. Laboratory. Isolation and identifying virus present in the sample, and this is a process very difficult, but we sometimes need to isolate the virus and identify the virus, either by propagating it in impregnated chicken egg or on tissue in tissue culture and see the cytopathic effect, or put it under the electron microscope Parasitology also a science involve identifying the parasites that may be present in the bird or its environment. Necropsy, it's a practical skill. We learn and teach post-mortem examination of the diseased bird may be performed to identify signs of the disease and aid in diagnosis. It's very important to make necropsy after we observe the flock and we take some dead birds, recently dead birds, freshly dead birds, and we cut the carcass and we see the pathology. As a veterinarian, as a pathologist, an avian pathologist, we can detect some very important necropsy findings, and this is discussed in full detail in the poultry diseases in my courses, and we will discuss some of it. The signs may be conjunctivitis, sinusitis, rhinitis, laryngitis, tracheitis. Important of poultry diagnostic, accurate and timely poultry diagnosis is crucial for several reasons. Early diagnosis and treatment, you can interfere and you can make some changes in the environment, either in your program of dieting, of feeding, of you change the nutrition formula. Early diagnosis and treatment, very important for as a poultry diagnostic, promptly allows for implementation of appropriate treatment measure, improving the chance of successful recovery and minimize bird mortality. Disease control and prevention. The early detection of outbreak help prevent the spread of disease within the flock and to other flocks. It's an emergency. Newcastle disease virus is discovered. We can make emergency vaccination for our other flocks or in the same flock if it's early. This is particularly important for highly contagious diseases like avian influenza. Also, we can make quarantine on these flocks. We can make some measures to minimize the outbreak. Food safety, diagnosis and controlling disease in poultry flock, ensure the safety and poultry product for human consumption. Also, we are responsible for the human consumed product, as in layers, egg, and also in broiler. Minimize the risk of foodborne illness. Monitoring flock health. Regular diagnostic help monitoring the overall health of the flock and identifying potential problem early on. The different diagnostic technique. Sorry for repeating this, but it's very important. It's basics for our course. We use ELISA for what, and what is the importance of the ELISA in the poultry industry and in diagnosing the diseases and in preventing diseases, in evaluating our vaccine program. It's very important. Immunoassay, as discussed earlier, they are highly specific and sensitive tests that can rapidly detect. ELISA one of them, and the most important one of them in poultry industry, as the kits of ELISA is available commercially. You can buy it from companies, and this is companies they all in the market and has experience in kits, in quality control of the kits. It's providing training like IDEX, BioCheck. Many companies are now in the market and has product approved, and also we can use it. Polymerase chain reaction, This is a highly sensitive technique used to detect the presence of specific DNA sequence of pathogen, but it's very sophisticated, somewhat sophisticated, need many equipment and need some money. Also, it's very specific. We need specific primer for every disease. Histopathology is involve examining the tissue sample under a microscope. It's need experience of the pathologist, the avian pathologist, and we identify the microscopic change associated with the disease. Serology, this involves measuring the level of antibody in the blood to assess exposure to specific pathogens. Immunoassays are powerful tools used in diagnosis of various poultry diseases. They are highly specific and sensitive, and also cheap, reputable, allowing for rapid and accurate detection of pathogen or antibodies in the poultry flocks. There are some examples of how immunoassays are used in poultry disease diagnosis, and very important. Enzyme-linked immunosorbent assay, ELISA. For many years, the immunoassays was used as with some dangerous conjugate the immunoassay by using these materials, and the enzyme conjugation was not accepted by inventing ELISA. This is the most common type of immunoassay, become the most common type of immunoassay used in poultry diagnostic. It can be used to detect antibodies against a wide range of viral, bacterial, parasitic pathogens. I discussed the history of inventing ELISA in the other course, or the introductory course for the technique, and how it's replace the radioimmunoassay. The radioimmunoassay with the after discovering the radioimmunoassay, it was the first immunoassay used, and but by replacing these dangerous material, or this has hazards in using the radioimmunoassay, enzyme-linked immunosorbent assay become the master of these immunoassays. But radioimmunoassay have its own importance in other diagnosing, flocking test, flocculation test. These assays are used to detect antibodies against specific pathogen. They are less commonly used than ELISA, but can be a simpler and more rapid alternative in some cases. Rapid agglutination test. These are point of care tests that can be used to quickly diagnosing certain disease in the field. They are typically less sensitive than ELISA, but can be a valuable tool for initial screening. In this lecture, we discuss the importance of early diagnosing of the disease. Also, we discuss the importance of immunoassays and the diagnostic process as a whole. Any question, please write your question or email me, or any unexplained point. I can fully detail explain it.